Hello, everyone. This is going to be my last talk for this meeting. And as it comes on the last day, I have chosen various cases representative of many organ systems in what's going to be just images to highlight some anomalies that potentially may be detected. And so, as I will show each of the cases, try to configure what you feel the underlying abnormality is, and then I will be revealing the diagnosis. I have no disclosures. What I would like for you all to keep in mind is that in the era of myths, we always tend to focus on chromosomal aberrations. However, we need to keep in mind that congenital malformations are 6.6 times more common. And the critical message is always exercise caution, because things aren't always what they appear to be. So let's start with this first case. Here, as we were sweeping through and trying to assess this fetus, you can see where the cord insertion is. I would like you to focus on cord insertion. And this first clip is without color. And here you can see that with the addition of color, look at where this cord is going. And this was at 12 weeks, 5 days. This was a case of a filamentous cord insertion. Now we go to what I've called case 2, but they are in fact 2 separate cases. And here is an attempt at a mid-sagittal view of 2 fetuses at roughly 12 weeks, 5 days. Looking at this mid-sagittal view, what I would like you to pay attention to is to the fetal maxilla, and compare it to what normal should be like. So in the top case, you will see that the proximal portion of the maxilla is completely missing, and the bottom case, all the ossification of the bony structures in this mid-sagittal view are abnormal. And this will take us back to when we heard the talk about the fetal face and the role of the maxillary gap that was described by Professor Shawi. These are cases of cleft lip and palate suspected from the mid-sagittal view.